Hello, my name is Molly Grassini. I am a resident physician at LA County, USC in the Department of Emergency Medicine, and I am here to tell you today about a new elective that we created at LA County, USC as part of this oral innovation presentation. I'll tell you a little bit about LA County, our program, and the population that we serve at our quote-unquote jail emergency department. So there are over 17,000 inmates in the LA County jail system at any given time, many of whom have complex medical and psychiatric conditions that, when the conditions become emergent or more complicated, require transfer to the jail emergency department at LA County USC, the hospital at which I work. At this part of our emergency department, every patient who is seen by a resident physician, who often have not had any prior experience working with incarcerated populations, and typically definitely have not had any experience interacting with correctional health systems. Through these experiences in the jail emergency department at LA County, USC, increasingly residents have become more curious and inquisitive about the correctional health setting, the barriers to care for their patients, and everything that happens to their patients in the jail health setting before they're transferred to our emergency department. So the purpose of the elective that we created was to expand residents' understanding of the correctional and carceral health systems by allowing them to experience the medical care system from within the jails themselves. Through this, we hoped that residents interacting with healthcare inside a jail would gain a better understanding of the existent barriers for their incarcerated patients who have and often continue to seek medical attention within the carceral health system before being transferred to our emergency department, and what faculties and facilities are available to the patients within the confines of a jail setting. So this is a new elective course that we offer for emergency medicine residents in their third or fourth years of training at LA County, USC. 2 weeks are spent in the systems at Twin Towers and Men's Central Jail. The residents who rotate through these units see the entire process of booking, and throughout it, basically they witness the entire process of being incarcerated from booking to being discharged, and they interact with every place within the jail setting that a patient will be seen by a medical provider. So they see where vital signs are taken when a patient first comes into jail, the clinics that they go to if they're there for sort of a primary care complaint, the urgent care that is available not 24/7, but only certain hours of the day, and that can, facilitate small procedures, short course antibiotics, things like this. And then they also see the psychiatric units. LA County jail system is the largest mental health provider in the state of California, and they see the expansive interactions between mental health and incarceration, not only in Los Angeles, but throughout the country through these experiences. They also witness the absence of care in certain areas, and many residents, I'm assuming, will have experiences similar to that which I had, which demonstrated to them that there were many indications for medical care witnessed sort of in their interactions within the jails, but that these individuals were not actually able to seek care in an emergent, urgent, or in some cases, any capacity. So those who have completed the elective this past year have reported that they definitely feel a more comprehensive understanding of all of the obstacles that an incarcerated patient seeks, that an incarcerated patient encounters when seeking care within the correctional setting. This has been a year of much demonstration and vocal outcries against the care that some people are receiving or the lack thereof within correctional settings. And many residents reported that the accompaniment of this elective during this time has facilitated for them an increased awareness of the limitations and dilemmas that face not only these patients, but also the providers in the jails who often wish that they could provide more for these patients, but have a dual loyalty that prevents them from doing so in such an easy and simple manner. So new discussions have come up frequently in our own facility about how we can better care for these patients once they arrive here, and what we can do for the populations that tend to be most systemically disenfranchised and thus often end up in these settings attempting to receive care, so that we can prevent their incarceration if possible, and at the very least come up with some alternatives to incarceration to further support their wellness and well-being. That is it for today. I am hoping that this presentation might encourage some of you at other residency programs to consider, if you have any interactions with the carceral health systems in your city and state, consider creating an elective. It opens minds. It allows for better interactions between our system and the carceral system, which I believe holds all of us accountable to taking better care of a population that has been historically and systematically disenfranchised, and a population for whom we can do a lot of good. Thank you very much to all of you who listened. Thank you to Dr. Todd Schneeberg, Dr. Rebecca Trotsky-Sir, and Dr. Shamsur Samra, all of whom helped me create this elective. Thank you.